the well-being of the EMT. You know, last night, what did I say the most important thing is for you to know about providing care for a patient? What's the most important thing? Your own personal safety. That's absolutely right. So this chapter is going to talk about how we maintain your safety and your health. The biggest thing that causes missed work days in EMS is going to be from back injuries. Brittany, in here? Somebody didn't come? Brittany Carson? Holy cow. Is there anybody that's not on the list, Seth? Acton, that's it? You weren't on the list?
No, I know this because I work with Brittany. I think she's on the day.
She what?
Brittany Carson. I think she's on the day.
Oh, okay. Sure she's on.
But don't.
Okay, I'll find out. Thank you for that. So this chapter is going to be how to keep you healthy and how to keep you well. A lot of this stuff you're going to already know, but some of you probably not really considered or thought about. So that's why we're going to spend a little time on it. We're going to look at personal protection. I don't know about you guys, but I hate the cooties. So I want to make sure that I'm covered and protected against catching the cooties. We're going to look at specific diseases that we are more concerned about in the EMS than possibly other professions because we have very close contact with some of these. So we'll look at those specifically. We're going to look at how our emotions and the stress of our job has an impact on our health. And then, of course, scene safety. That's always fun. You know, just because we're there and we've come with lights and sirens doesn't mean that everything is safe there for us. So we're going to look at that also. In order to be effective and do a good job in this field, we have to be healthy. Sometimes we have to crawl down, steep embankments, crawl up steep embankments, carry patients up and down steps. So we have to be in pretty good physical condition in order to do this job. If we're not able to do our job, then our patients are going to suffer. Did y'all read the paper a couple days ago where there was a paramedic upstate Alabama somewhere, I think that's where it was. No, it was up north somewhere. And they were doing CPR on a patient, and he just fell out with a heart attack. So that's never good. It's scary. Those things happen from time to time, but we need to be as healthy as we possibly can so that we can help our patients. So Sid, these are some things that you already know, but it's important, and I say this because EMTs are notorious, in my experience, notorious, not just famous for, but notorious. And once you graduate, you go to work in the field and you work, 150 hours a week. Oh man, this is so great. I'm going to work 1,000 hours this week. And, after a few months of that, you're just dead and you're not of any use to anybody. But once your life gets out of balance, you need to keep everything balanced. Your home life, your relationships. You got to exercise. You got to have time for yourself. You got to have your work life. If you're religious, you need to be involved there. So you really need to keep your whole lives well balanced. And by doing that, you're emotionally healthy and you're physically healthy. This job is very emotionally stressful at times. I worked with a guy down south that he had a call late at night up on the interstate. We worked right off I-65 down outside of Mobile. And he went and he worked on this girl that ultimately passed away. But, he lived and worked in that community. He didn't recognize her. Come to find out it was his fiance. And did you think that was devastating? Absolutely devastating. So it's very emotionally draining for us. So it's important that we have the other parts of our lives to support us rather than tear us down. If you're doing a lot of partying and hard drinking and stuff like that on the weekends, you're not going to be worth anything on Monday morning. If you're not getting exercise and eating right, your body is not going to be healthy. So when you're working in a stressful job like this, and anywhere in healthcare can be very stressful, but EMS in particular is extremely stressful. You've got to take care of yourself. Nobody's going to take care of you. There are going to be days, and I have myself, where you're at work at 7 a.m. and you don't see the inside of a place to eat for about 18 hours. I remember feeling like I was going to gnaw my arm off sometimes because you're so busy you don't get to eat. So it's important that you prepare for those times. Like I always carry granola bars and stuff with me. So there are a lot of things that go into maintaining your well-being, and so having a balanced life is important. Got to eat right, sleep right, limit your alcohol and caffeine. You know, we joke at EMS that we just live on caffeine. So that's something that I would be very careful about early in your career, not getting hooked on a bunch of caffeine. And then make sure you keep up to date with all your vaccines because we are exposed to disease. So let's stay healthy. PPE, personal protection equipment. We have two things we talk about, standard precautions. These are things that you're just always going to do. It's going to be standard in your patient delivery, your patient care delivery. You're always going to use your standard precautions. And all healthcare use standard precautions. One thing you always know that almost all your healthcare providers, including your dentists, they're always having on when they're like touching their gloves. That's going to be standard precautions gloves. If a patient has tuberculosis, standard precautions are going to include a mask for that. So there's certain things that you will take to help protect yourself from disease. So that's going to be standard precautions. Now, your service is required to provide you with all the equipment that you need to have in order to protect yourself. They can require it, they can tell you to wear it, they can put it on your ambulance, but they're not going to follow you around and put it on you. So you have to make that personal decision to use it. And there are lots of times where I see people and I go, I can't believe they're doing that and they don't have gloves on. Or I can't believe they're doing that and they don't have a mask on or whatever, or eye shield. So it's up to you to do it. And I will tell you that if you get sick or you catch a disease from a patient and you weren't using the standard precautions or the equipment that you were provided and you should have known better, they're going to leave you out to dry. They are not going to pay for that disease process because you didn't do what you're supposed to do. It's kind of like not wearing your seatbelt when you're driving an ambulance. If you get in a wreck and you're not wearing your seatbelt, they basically say, paid it for you. See ya. Call your health insurance company and see if they'll pay for it because we won't. They're not going to pay for your time off work. They're basically going to roll you to the curb because you weren't doing what you were supposed to do. So we have a requirement if you want to be protected under where you're working that you use the personal protective equipment that they provided for you. When in doubt, man, there have been plenty of times where I've been suited up. I've got mask shield on. I've got a mask on. I had a patient one time who, you have a mask on. What do you think? You're going to catch something from me? I'm afraid you're going to catch something from me. So they kind of back off. So yeah, I'll suit up to be on the safe side. Consequently, I hardly ever get sick. Too bad for y'all. That means I'm here every night. There's not going to be canceled class because teacher's sick. These are some of the items that you'll have. Of course, these are gloves. These also are gloves, I guess in different sizes. These may be, sterile gloves. I'm not sure. This is just is that a, I can't tell. These masks are fitted to you specifically. These are a high particulate mask, HEPA masks. This will be a shield for your eyes. Anytime you've got a patient that's vomiting or they're squirting blood or something, I hate getting vomit in my eyes. I don't know about you. It's one of the things I hate. So I wear goggles. I would wear goggles a lot. This is a dual purpose. It's got a shield and a mask. You just slide those little things over your ears. This would protect you if somebody was just sneezing like they had a cold or something like that. If they've got tuberculosis or something of that sort, some of your respiratory diseases, you have to have a high efficiency particulate mask that kind of filters out those very, very small particles. So we'll talk about some of those too. Gloves. You should always have at least one pair of gloves on you and in your pocket somewhere. I would always carry 2 sets of gloves. If you get a rip in one or it gets nasty and messy and you have to change out to another glove, I want to have another pair then so that I'm not tempted to do something I shouldn't do, like pull my gloves off and go without them. So always have your gloves on and carry some. Now, when we say always have your gloves on, that doesn't mean you need to for a 24-hour shift, you got to go around like this, like a surgeon with your gloves on. Not so. Because you're going to put new gloves on every time you have a patient encounter. But you really don't want to be driving the ambulance with your gloves on or doing other things in the ambulance with your gloves on. Just before you make patient contact, or as you're walking up to the door, you may slide your gloves on so that you have them on when you get inside. But patients pretty much expect that. But when you wear those gloves, anybody ever wear those gloves? You know what I'm talking about here? Yeah. What happens underneath those gloves? You sweat like a pig in there. So what else happens? It's dark, it's moist, and it's warm. What are we growing in there? Oh, yeah, all kinds of nasty stuff under there. So you want to wear it when you need it. When you're done, pull them off, and always wash your hands, or at least use some of that, the alcohol cleaner, because of what you are growing under there. You know, like you pull that off, and you go like this, dry them off, then you start eating the sandwich. Don't do it. So always clean yourself. Consider double gloving. I kind of mentioned I always carry an extra pair of gloves. Say you're on a bad scene, a bad trauma, and you've gotten, blood or whatever on your hands. You can't pull those. What's going to happen when you pull those gloves off and try to pull another pair on? Just think about what's under there when you pull that off. Oh, you bet. They are so sweaty, you will never get another pair of gloves back on there, unless it's a size 47 triple E or something. That's all you're going to get on that glove. So if you pull up on a scene and it's, you can tell it's probably going to be something taxing, I'll put 2 pair of gloves on, one and then the other. And then if you get one nasty, you can peel the outer layer off and you've got a fresh pair of gloves under there. But you'll never get them on after you move a pair. So, now a lot of people have latex allergies, and you can develop a latex allergy if you use latex repeatedly. So we're seeing increased incidence of latex allergies in healthcare providers. So just kind of be aware of that for yourself. A lot of places are starting to use non-latex gloves, but I don't know, latex fit better. Remind me on the lab to show you how to put your gloves on and off. I don't have any gloves here. If they're nasty, you don't want to grab it like this and spread all that goop everywhere. So you got to be really careful about pulling up the end and sliding that off so that you're not contaminating your hands any worse than they are already. You will hear this over and over, and you'll get test questions about it. The best way to prevent the spread of disease is going to be what? Washing your hands. So you can always tell a healthcare provider, like if you're at the stadium or something and you're over there washing your hands. I know it's not you guys, but girls, when you're in the bathroom, I'm teasing you. But when you're in there and you watch people wash their hands, healthcare providers wash their hands for a long time, and they usually have already scrolled down the paper towels so that you wash, grab the paper towel, dry, and then they turn off the sink like that. Because you don't want to touch that sink. Because lots of times people will turn it on just to get water, but their hands are dirty and they don't really wash. So, but make sure you wash really good with soap and water, and make sure you're cleaning your nails. Like after your shift, when you go home, you need a nail brush to make sure you scrub up under your nails too, and then dry your hands well. When you use those alcohol cleaners, you want to rub that on, but you want to allow them to air dry. I saw some guy one day, he put it on, did it like this, and then he wiped it all on a towel. That didn't do any good. The way those things work is the air drying allows them to kill the bacteria. Okay. Only use those alcohol-based sanitizers if you don't have soap and water. Soap and water is going to be superior. That flowing of that water is what washes the germs away. Soap doesn't kill any germs. You knew that, didn't you? Soap doesn't kill germs. It's just a lubricant to help wash them down the drain. So you want to use those whenever possible. Get in the habit of cleaning your hands. It's a habit like anything else. Now we use eye protection, the goggles, whatever, to prevent splashes. Anytime you have a patient that's vomiting or bleeding a lot, I want to have on some type of eye protection. If you have a patient that tells you they feel sick at their stomach, probably going to put these guys on. Anytime you're ventilating a patient, like even in CPR, when you're doing chest compressions and somebody's ventilating the patient, those patients sometimes still vomit. So anytime you're working a cardiac arrest, you probably want your goggles on. So anytime there's a risk that something may splash, you want those on. I said that good. I mentioned a minute ago about the HEPA, the high efficiency particular air mask. We call those N95s, and they are 2 types. You can see how this is. There's some little pieces of aluminum in there that causes this to fit very well, and they come in sizes. So you should be fit, if you ever work in the field, they should fit you for that, a mask fit, so that you'll always know what size you wear, so you'll know which to grab. And sometimes you may actually wear a gown. Now I know you're thinking, why in the world would I wear a gown? You know, if somebody is like vomiting all over the place, just helps protect your clothing. If you have a patient that has a communicable disease, such as MRSA, a contact MRSA, then you may want to wear, you know, the whole thing. If you're delivering a baby, you can't get enough clothes on to protect yourself. So yeah, you'll always have a gown of some sort. I haven't worn them very, very frequently at all. You hardly ever see anybody in them. But when it's called for, you want to have something to put on. Y'all okay with all that? Pretty quick, huh? Let's look at some specific diseases that you need to be concerned about. And I think I forgot to mention something last night that I wanted to mention. And stop me if I told you, because I've talked the morning with you. Did I talk to you about making note cards? Okay. The best advice I can give you to do well in this class is to make your own note cards. Little 3x5 note cards. And every disease or disorder or injury that we talk about, you've got your note card. And you give it a name. Like we're probably going to talk about tuberculosis. You'll put TB on there. Then you're going to list those signs and symptoms. You'll list medications if we use any medications, treatments, outcomes that you're looking for, contraindications, all of that sort of stuff. And throughout the course of the semester, you can add to those note cards. Later on, I'm going to give you a sheet, a little drug sheet, where you'll keep up with all the drugs that we're going to be able to give. So if you start those note cards now, particularly if you go on to the program, you'll have a pretty big stack. Greg Brewer, who's one of the instructors for the day class, he had a big notebook. I mean, it was a big notebook. And he had a whole page for every single one of these things: drugs, disorders, diseases, that kind of stuff. So he could add to it as he went through the program. And I highly recommend that, because I find that that's one of the weak areas of students, is they can't differentiate between the signs and symptoms for different disease processes or traumatic injuries and that sort of thing. Signs and symptoms, treatment. And those are going to be so key to doing well on the registry, because you've got to be able to differentiate between those different things. So I highly recommend you start note cards. They're like flashcards for yourself. Okay, diseases of concern, which these will probably go in your note cards. Now, hepatitis itself there's several forms of hepatitis: A, B, C, D, and I think there's an E also. There's a G. Several forms of hepatitis, but they're not all as virulent or as contagious, say, as others are. Hepatitis B and C are the ones that we're probably most concerned with. Now, you all had to get some type of hepatitis immunization, right? What was that? Hepatitis B. There's no immunization for hepatitis C. Now, there is an immunization for another hepatitis. You know what that one is? A, that's right. And how is hepatitis A transferred? Is it what? Yeah, it's generally through fecal matter, but it's we get a lot of it in our food. Like if you travel, it sounds really gross, doesn't it? It goes you out. If you travel a lot, if you eat out a lot, eventually you're going to get a bout of hepatitis A. It's almost like getting the flu or something. It's not something that stays in your body for any length of time, but you can get very, very sick from it. So you can get an immunization for hepatitis A. Like I've always liked to travel out of the country, and so I stay up with my hepatitis A because I hate stuff like that.
Do you get it from contaminated water, like the baby crabs and something?
Hepatitis B and C are very hardy. They are very infectious, and they affect the liver. They destroy the liver. How do you recognize a patient that has hepatitis usually? If it's active hepatitis? They're jaundice, yeah. They're yellow, exactly. They look like they're sure. Yeah, if you look at them and they look they got that yellow cast to them, then you're suspecting that they may have some type of liver disease. Hepatitis B can actually live on a dry surface for quite a while. I've read several different things. One says several hours, one says several days, one says a month. However long it is, it's too long. So you could come behind somebody several hours after they've been there. If they've left a little bit of droplet or something and they have hepatitis C or B, hepatitis B, then you could contract that. So it's going to be the most infectious, and it takes the least amount of the disease to transfer it to you. Whereas something like AIDS, for example, you've got to have a fairly significant amount of that virus in order for you to contract that. You know, you're not just going to walk by and, you know, wipe a little bit of virus on your hands and get it. That's not going to happen. It has to be a much greater concentration. So our biggest worry is not AIDS, like most people think. Very, very few healthcare workers contract AIDS through the job, extremely low. Whereas hepatitis, something quite different. It can live on dried surfaces or in dried blood for several days. And it doesn't have a big sign up saying, oh, Johnny came by and left hepatitis on the desk. Hepatitis is deadly. This is the one we worry about as healthcare providers. That's why we insist that you get the hepatitis B vaccination series. Now it's not, we don't contract it nearly as easily because of the vaccine. Hepatitis C, as I said, there's not a vaccine for that, but it still is just as contagious. We just don't, it's not as common as hepatitis B. So all y'all are going to make note cards on hepatitis, right? Okay, tuberculosis. Who can tell me which body system tuberculosis most commonly, it's most commonly respiratory? Probably 90% of the time it's respiratory. But it can also appear in other systems of the body. Just most commonly it's respiratory. It can be highly contagious. But in order to contract tuberculosis, you need to be in close proximity with that patient. Just for sitting in this classroom, you know, 1 or 2 nights a week with somebody that has tuberculosis, you probably have an extremely low chance of contracting that. In, say, a nursing home where a lot of those patients live very close together, you know, hour after hour, day after day, constant exposure is going to increase their risk of tuberculosis. That's why we see it in populations that live very closely, you know, a lot of people in a very small space. You know, as Americans, we like to spread out. So we don't see it as commonly in the American population as we do in populations that come from other areas, just because we don't live that close together. But prison populations, we've seen an uptick in dorms, you know, where you know, students live close together in very close housing. So tuberculosis is something we do want to be cognizant of. It's going to be spread through the air, usually water droplets. You know, when somebody coughs, you know, you can spread a lot of stuff through a cough. I have a video if I could find it. I should have found that. You see somebody coughing. I mean, if I coughed or sneezed, I mean, I could hit most of you guys right up front. And with some of my really big sneezes, I could probably hit you guys on the back too. So it's going to be spread that way. Any patient that has a productive cough, that one set bells off for you that says, ooh, that patient could have TB. Just a productive cough means what? Yeah, he's bringing up some stuff. So even if he just has bronchitis or who knows what he's got, it may not be TB, but that's going to be the first thing I'm going to think of. There's a possibility here, so I'm going to mask up. Patients very frequently report night sweats with tuberculosis. Did I mention this the other night? No? Okay, it was a day group. When you make your note cards, that's one of the things you're going to list under tuberculosis. Because what will happen is, on National Registry, they're going to give you a scenario of a patient. They're going to say, you arrived at Mr. Smith's house at 2 a.m. in the morning. He tells you he's been up most of the night coughing, and he just keeps breaking out in these cold sweats all night, and he doesn't have a fever. You should suspect A, B, C, or D. The first thing that should come to your mind is what? Tuberculosis. Not because he's been coughing all night, or he hasn't been able to sleep, or that he doesn't have a fever, but it sounds like night sweats. So does it mean that it's absolutely TB? No. But the question said you should suspect. That would be the most likely scenario, but it may not be. But night sweat should ring that bell that says TB. HIV, AIDS, as you know, is an immune system disorder. It leaves the patient unable to fight off infection. They have a very weakened state, and it opens them up to secondary infections. A secondary infection, or an opportunistic infection, comes about because you had an initial infection that lowered the system, and now other things come in. For example, pneumonia is a secondary infection. And most of the time, you don't just present, you know, I'm fine today and now I have pneumonia. Most of the time, patients had some kind of upper respiratory infection, and now it's moved into the lungs and become pneumonia. So let's see. I did mention to you that the risk for HIV for us is very, very low. It's very low, especially with the advances that they've had in the last probably 10 or 15 years. The biggest issue used to be needle sticks. Well, now they've got all those automatically retractable needles, and there's so many protective devices that we just don't hardly ever get needle sticks anymore, unless you're extremely careless. HIV is what we call blood-borne pathogen. That means it will be in blood products. So you have to contact the patient's blood or some blood product in some form. Are there other body fluids that have blood products in it, do you think? You gotta really think about it. Do you think synovial fluid? You know what synovial fluid is? Think synovial fluid. How about amniotic fluid? How about semen? Do those things have blood products in it? How about cerebrospinal fluid? Yeah, all of those things have blood products in it. Now, you don't look at it and it looks bloody, but there are parts of blood, the plasma part of blood, may be in there. So the amount of the virus is probably less, but it's still there nonetheless. So you want to be aware of blood products. So anything, I say if it's wet and it's not yours, then stay away from it. So if you've got a patient that's got any type of oozing stuff, I'm going to consider it infectious. Okay, we got a short thing on emerging diseases and things that we're seeing now that we didn't used to see 20 years ago when I first started this. West Nile virus, who knows what that is? Yes, it's mosquito-borne. I know I moved up here from the coast and we have a lot of this kind of thing. West Nile virus, mosquitoes, it kind of gives you that flu-like symptoms. Sometimes you don't realize that you have it, but you can get extremely ill from this. It can cause spinal meningitis, infection of the brain, not good. But you can get very sick. People die from this. You heard of SARS? Did I say this last night? Nobody knew what that was? SARS. Severe acute respiratory syndrome. What's the difference between a syndrome and a disease? Any ideas? Just based on what those words mean, what do you think? A syndrome is a group of illnesses that kind of present alike, and they call it a syndrome because they can't tie it and say it specifically. This is pneumonia. This is tuberculosis. So SARS is a group of respiratory disorders that kind of get lumped together, and they're not really sure what it is exactly, so they call it a syndrome. So SARS is going to be spread through respiratory, usually through droplets, much like tuberculosis is spread. These patients usually have a dry cough. That's different than usually the productive cough that you get with tuberculosis. Patients will have difficulty breathing, and they usually are feverish. They've got something going on there. They're sick. And a lot of people around the world have died from SARS. They had an outbreak probably 5 or 6 years ago in Canada where somebody brought it in from some Asian country, flew into Canada, and they ended up having to quarantine an entire hospital, and several people died. So it's very contagious. Flu. Flu is spread much more easily today than it was, say, 100 years ago. Why do you think that's the case? How is flu spread? Same way. It's going to be spread by close physical contact, sneezing, coughing on a patient. So how come it spread much more easily today than it did 100 years ago? There's probably about 20 things you could say. The population, certainly. Our population has greatly increased. And where are we living now that we didn't used to live? Yeah, we live in groups, in cities with high population. We go to places where there are a lot of people there. 100 years ago, I'd lived out on a farm. I wasn't alive 100 years ago, I promise you. But if I did, I would have lived out on a farm somewhere. I'd milked my cow in the morning, picked up my eggs from the chicken, and gone and made an omelet or something, and really not encountered a lot of other people. So for us, then, there wasn't a whole lot of that. But when they did get one that was really severe, like they did in 1918, they had a pandemic. Pandemic really means it was all around the world, where a lot of people died from that because they didn't have, they didn't know about hand washing. They didn't have the other things that we have that can help us. But they tell us that we are poised for a worldwide pandemic of flu. And every year they say it's coming. So let me suggest to you, if you haven't done it yet, I think they require you to get your flu shot. Even though you can sign a waiver, get your flu shot. You do not. How many of you guys have had the flu? I mean, really the flu. Not just, oh, I'm being sick. I'm talking about the flu where I'd rather be dead than have this again. That's the flu. Yeah, I had it in 1986. I remember. So I will never have that again if I can prevent it. The avian flu, that's one of, they call it avian flu because who are the avian people? Yeah, those are birds. They're not really people. But it's found in birds, and now they're finding that it can be passed to humans, and it can be pretty bad too. And then the swine flu, H1N1, a few years ago, that was a super big deal. But every year they have some new flu strain that they're concerned about, and that's usually what the immunization is that we get. But it scares people to death, and so when people get really frightened that you're going to catch this deadly flu, people really alter their behaviors, and sometimes not in a positive way. Okay, infection control and the law. We, by virtue of what we do, we encounter patients that are sick. I think I said last night, it was in here, that we are like the canary in the coal mine. You know, we're going to be the front line. We're the ones that we're going to get quite a few healthcare workers that come down with one of these diseases before they recognize there's something in the community. I think just a few months ago there was an outbreak of something down in Dothan. Does anybody remember that? Nobody? Are y'all just not going to help me at all? I have to do all the reading for you. Do what? You don't remember? Yeah, they had some outbreak of something and somebody died, a couple people got sick. And so they thought it was developing into a big deal. And, you know, the CDC rushed down there and started quarantining people. And it turned out it was nothing, you know, somebody just got sick. But anyway, we're going to be the front lines there. So you just have to recognize that we are at higher risk. And we have to be extra careful. That's all. Just have to be more careful. Now, every service has to have an infection control plan. Meaning, if you have an exposure at work, you get a needle stick, or you have a patient that you suspect has tuberculosis or hepatitis or something, they have to have a plan in place to manage you, to have you tested, have the patient tested, have you treated, you know, whatever they need to do to protect your health. They have to have a plan in place. So wherever you work, there's going to be an infection control officer who you will know, and if you suspect that you've been exposed to something, you will go to that person, and it's all completely confidential, and they will manage your care and follow-up treatment and that kind of stuff. So, but they're required to have that. They're required to manage any bloodborne pathogen issues. That's why they're required to have those personal protective equipment for you. Anything that you need to prevent the spread of disease. They're required to make sure, they're required to provide your immunizations. You know, if you're working for a service, they have to provide you with that TB skin test. They're supposed to do that. If you haven't had your hepatitis B vaccination series, they're required to provide that for you. So some of them try to balk at that, but federal law requires that they do that. Okay. As part of the infection or exposure control plan, they have to adequately train you so that you know what's out there. I mean, I give you the overview of it, but they're required as things change, you know, as new diseases develop, new outbreak scares, they're required to train you and protect you as best as they possibly can. They have to provide you, I mentioned, with the equipment. They have to make sure that when it says housekeeping, that's things like they have to be sure that there's a sharps container near you on every ambulance. You know, if you are, say you're a paramedic, you're starting an IV on the patient, and you pull out that sharp, which you're going to remove from your catheter, and you have to get up and carry it to the back of the ambulance to put it in a sharps container, that's not safe. You can see that as soon as you pull that sharp out like this and stand up, the guy driving's going to hit the brakes and you're going to like stab yourself in the chest. Yeah, so they have to have it accessible. That's one of the legal requirements. So they have to provide you with the things that you need to do your job well. There's something called the Ryan White Care Act, and this came about many years ago from a young boy that had contracted AIDS through, I don't know, blood transfusion or something. And at that point, you were not able to share any information. If you had AIDS, it was like, you know, the worst thing in the whole world. You couldn't tell anybody. So patients didn't share that. I couldn't, if you were my partner and I knew so-and-so had AIDS, I was not allowed to tell you that the patient had AIDS. So it was like this big hush-hush thing. And that's not fair to us as healthcare workers. We need to know if a patient has something that could injure us. You know, it's important to our safety. So there was the Ryan White Care Act, which allows us as EMS providers to find out if a patient has a disease that we could be affected by. So going through certain steps, it will require a patient then to have to submit to testing if we suspect that they have a disease that we've been exposed to. So that's good. So at least now we have the legal tools to find out if a patient's carrying something so that we can be treated for it. In the event you think you've been exposed, or sometimes the hospital tests a patient at the hospital and they find out, oh, the EMS crew brought this patient in, they didn't know that he had hepatitis, because you know, you don't wear a big sign on your forehead. And so they have a legal requirement to notify our infection control officer, who then will notify you, whoever was exposed, and provide whatever follow-up care is required. So that's what this act requires. It requires a hospital to notify back, and then both ways if we suspect that a patient has a problem. Immunizations, we've talked about hepatitis B. You will have to have a TB skin test every year. If you go through this program before you start next fall, whatever's happening then, you'll have to be retested for TB. Your services, they should retest you every year for TB. That's for your protection. Okay. Hey, let's do this. Let's take a quick break because we've been at it for an hour now. Let me turn this thing off. Oh.
If you look on the 119 on Canvas, he has a list of everything you need to have. On the syllabus has that.
On the syllabus?
The only thing I already have a pair of scissors here that I have to carry for a flash job. Will that work instead of like bandage scissors?
Yeah, yeah. Sure. Hey, y'all ready to hear about emotion and stress? And the kind of stress you guys are experiencing right now, being in class, and I make you talk. Yeah, I know that's stressful for you. We talked a little bit about how stressful this job is, so we're going to look at that a little bit more closely. I said that this is stressful, but there are some signs and symptoms that you'll see when people start getting under a lot of stress. It starts affecting their work or their personal life. So we want to make sure that you can recognize those if it happens to you or happens to a friend of yours or a partner or somebody around you. There are 3 stages of stress. The first one is what we call the alarm stage, or the fight or flight stage. And at that point, the central nervous system, the sympathetic nervous system kicks in and kind of raises the stress in your body. So this would be a sympathetic response would be like if you're out camping in the woods and all of a sudden this big black bear starts chasing you. What happens to your body? You wet your pants? What starts happening to your body? You look back over your shoulder and there's this big black bear bearing down on you about 15 feet away. What happens in your body system? You what? Oh, you bet. Your adrenaline kicks in big time, and that activates that sympathetic nervous system. I remember that sympathetic response because it's like, my body's having sympathy on me, and it's going to give me everything I need to get away quickly. So a sympathetic response starts becoming activated in your body. So your heart rate ticks up, your respiratory rate ticks up, you vasoconstrict, your eyes, your pupils dilate. All of these things are taking place as part of a sympathetic response in your body. And as you know, I know if any of you watch TV, there are always those ads about, you know, you're fat because your cortisol levels are so high or so low, I forget. But it's that constant stress in your body very bad for it's very bad for you. So we want to keep that in check. But in what we do, we sometimes have those spikes, you know, that alarm goes off. What happens in your body? You get a huge sympathetic response because you don't know what's going to happen. It could be little granny, you know, that wants you to come and, you know, let her dog, you know, out of the closet or something. But it could be something very serious and you don't know. So your body kicks it up, gets ready for something really serious to take place. So when that continues to happen, it wears on your body. So you have to try to counteract that stress. So that's going to be your body getting ready for something stressful. The second stage is resistance, where if you've done this long enough, certain things don't have the same impact on you as it did, you know, the first few times, the first few months, and the first couple of years. You know, it's kind of like the first night here, I guess I scared you guys to death. I mean, I didn't see any lips move. None. But by the end, y'all are going to be like this. I'm going, if they don't shut up, you know, I'm going to have to, like, burn the building down or something. So you get used to it, and your behavior changes a little bit. You start coping with it. It don't scare you so bad anymore. So I don't know if that's a good thing or a bad thing. But so the second stage is you develop a resistance. You cope with that constant stress. And if you cope well, you know, you can manage it. But the third stage is where you've tried to cope for so long and you just can't cope anymore. Your body just wears out from the stress of whatever it is. So you start showing signs of that burnout stage or that exhaustion stage. So this is what we're going to be looking for. So we're looking at acute stress reaction. There are several ways that we are impacted by something that happens at work or some other environment that we're in. It could be a specific incident that occurred. I had a friend quite a few years ago that ran a call on Christmas Eve, and it was a drunk that hit a family head on. They were on their way to grandma's with all the presents in the car. And it was like the mom and dad and 2 or 3 kids. And so he arrives there, and there are Christmas presents everywhere. There's some people screaming. It's mostly the drunk who's screaming, but the parents and I think 2 or 3 children were killed, like right there. So that's always in the back of his mind. It's always going to be a stressful event for him. Christmas Eves, he said for years, as long as I've known him, they're stressful for him because he recalls that event. So it's one particular event that can cause a lot of stress. But it can also be cumulative. You know, we talk about post-traumatic stress syndromes. Did I say it right? Where it's just a combination of things that just kind of build up, and pretty soon you just can't handle it anymore. So it could be one or the other, but the symptoms often are very similar. But the reactions or the signs and symptoms that you see may be physical. What types of physical responses might your body have if you're like just on total overload? Physically, what might you feel? Just total exhaustion. Sure. Your body's just, you know, you've lost that balance in your life. So your body is not able to cope anymore. So you're just physically exhausted. What else? You may not sleep well. You'll start seeing some emotional and behavioral parts of this where you start arguing, you know, with your friends or your significant other, whoever. You argue a lot. You may become depressed. What other things then start happening once all of these things start taking place? How do most people try to cope with that? Yeah, alcohol. They start drinking, they start doing drugs. So it can be very, takes a very high toll on us as healthcare providers. But you need to be able to recognize it in yourself as well as those around you, because if you're physically exhausted, you're short-tempered, or you fail to engage, you won't make a decision, you're cranky all the time, you don't take deliberate care of yourself and your patient, what kind of outcome is your patient going to have? Probably not so good. And you know, that's what we're worried about here. That's why we're doing this, is for our patients. So if we can't manage our patients well, give them the care they need, then we don't need to be doing this. If you have, you can have an acute stress reaction and it's considered normal. You know, like my friend that ran that call where almost people were killed, you know, for some amount of time after that, he was very disturbed. And would you consider that to be normal? Yeah. You bet. Wouldn't you be freaked out if you'd had a call like that? So initial reaction to that is probably completely normal. But if you don't manage it well and take care of it, then it can come back and cause a lot of physical and other damage to you. But some things where it's important where you have to have, a professional. And there's nothing wrong with that. And sometimes people think there's a stigma associated with that, but we lost too many people from the 9/11, the Twin Towers, first responders, firemen, paramedics, police, because of the stress that they incurred during that event. So don't ever be embarrassed that you need to get some assistance with an issue like this. PTSD, we talked about that. Signs and symptoms often don't present right away. They don't present until much later. And that delay keeps us sometimes from hanging it onto or identifying the cause of that. If it's 6 months later or a year later, you may not really recognize it and realize it was because of that traumatic incident, or you may not recognize that it's just accumulation at that point. Cumulative stress. Early signs, vague anxiety, just kind of feel stressed a little bit all the time. You're emotionally exhausted. How would you recognize somebody that was emotionally exhausted?
Their eyes, the way they look, their eyes might be real puffy and they haven't been asleep, something like that.
Yeah, sometimes you can physically look at them and you can tell. It's just like with every class, I usually get a few people throughout the semester that get sick. And sometimes you just look at a person and you know they're sick. And you couldn't say, well, they look pale or they're diaphoretic or whatever it is. They just look sick. And it's hard to pinpoint that sometimes. When a person has emotional exhaustion, sometimes you will notice that in their behavior. They're cranky. I just spent 9 days with my daughter while I was waiting on her to have a baby. I'm thinking, if you don't have this baby soon, so I was babysitting and cooking and cleaning around the clock for like 9 days. By the time I hit this school on Monday, be glad we didn't have class on Monday, I was pretty cranky. I was emotionally exhausted, physically exhausted, but just very touchy and very cranky. And so I knew that day that I was just very short with just about everybody I encountered. I was emotionally exhausted. So you'll recognize that in your friends, your coworkers, where they're just a little bit touchy, they're just a little bit cranky in ways that usually they wouldn't snap at you like that. So that's a sign, an early sign of emotional exhaustion. If it continues and it's not managed, then it's going to start manifesting itself physically. They're going to have stomach aches, I've got headaches, not sleeping well. So it's going to roll into their physical well-being. And then from there it will go into depression and who knows after that. So once you see this happening, it's important for you, it's you to get some help, but if it's somebody that you care about, that you try to either talk to them about it so they can recognize it. But the bottom line here is if this stuff is occurring at work, then they're jeopardizing patient care. So you have to make sure that you intervene if you possibly can before something bad happens. Move yourself over. There. What types of calls do you think can cause the most stress? So kind of picture yourself on the receiving end of that 911 call. You're in the ambulance. You're going to a scene. What types of things do you think are going to be most stressful for you? There's probably about 10 things you could say. Y'all think of something. Anybody think of one? You got one? Children. Why do children freak us out? Yeah, you hate that kind of thing because they're little and they're so defenseless. And another reason for that is we really don't see that with children. Probably 10 to 15% of our calls are children. And when you get a pediatric call, they're usually real. Parents don't call because Johnny has a stomach ache. They take him to the doctor. They call when it's serious. Johnny's unconscious. Johnny split his head open. So yeah, pediatric calls can be very stressful. What other kinds of calls do you think can be really stressful?
Family and friends.
Yeah, if you know somebody. We really are in a small community here. And the chances of you running, when we say running, that means responding to a call that involves a family member or a friend or somebody you know is probably pretty good. So yeah, family and friends. What else? Sometimes elderly can be very upsetting for you, you know, depending on, you know, especially if it's somebody close to you. That can be difficult. What else?
Like a big crowded scene.
Yeah, if you've got a lot of onlookers, there's a lot of people around. And what's disturbing about all those people standing around?
Well, I've seen it where some of them are taking pictures and stuff and trying to,
Yeah, and that's never a good idea. And it's hard to prevent that. When you have a big crowd, then you know people are watching you. And sometimes things that you do can be misinterpreted. And you certainly don't want that, but you can't help it. Plus, oftentimes they get in the way. But the biggest thing is you feel like you're on a show, you know, you're on stage. And people get very nervous like that. So that can be disturbing. What else? For those of you guys that read the book, suicides can be very difficult. I've had quite a few of those, and they usually are quite messy. But you know the person is more than likely very mentally ill, and so much of that's preventable. What else can be really disturbing?
yeah.
Yeah, if you have a multiple casualty incident, we'll talk about those later this semester, where you have a lot of injuries or a lot of death, that can be disturbing. What about if you get that call and that little convertible runs up under that 18-wheeler and has cut the heads off of the two people riding in that? Would that be disturbing? Yeah, very traumatic injuries like that can be very disturbing for you. You know, somebody's got to do those calls. Even if like the head didn't come completely off, you may have somebody that's alive that's very, very critically injured. Those can be very disturbing for you. And it's, this field is not for everybody because of that. Some people can't manage that. But when you look at it, that not a lot of people can manage that job, but if you can, we need you out there because a lot of people can't do it. So you can do things that a lot of other people can't. I lived across the street from a lady years ago, and a couple of kids fell out of this loft onto a cement floor. And instead of doing something and running to the kids, she just started screaming and she ran out in the street. And I went, woman, what are you doing? You've got two kids in your garage in there. They're unconscious on the floor. And she's going like this out in the street. So, yeah, if you can manage this kind of thing, we need you out there because most people can't. Yeah, that's my 2 cents worth. Causes of stress, let's see if we covered them all. MCI, multiple casualty incident. If you've got a lot of things going on, you know, a lot of people injured, that's extremely stressful. Infants and children, severe injuries, abuse and neglect. You know, nobody really mentioned that, but yet, pediatrics or your elderly, if they've been abused or neglected, that's just a real heartbreak. Death of a coworker, I'm surprised somebody mentioned that one. You know, I talked about the guy that was doing CPR on a guy in cardiac arrest and he had a heart attack. Over the course of time, you're going to have a coworker that dies and you may have to run on them. Work-related issues involving family and loved ones, causes of stress. Well, yeah. Boy, that went by fast. Signs and symptoms of stress. We've kind of touched on these already. Usually the person gets cranky. Cranky is one of the first ones that I will usually recognize. Somebody is unusually cranky for themselves. Some people are just cranky all the time, right? But if they're unusually cranky. Another one is inability to concentrate. You know, they just can't stay on task. Have you noticed that yourself? You know, if you're under a lot of stress, you got a lot of things going on. Sometimes it's hard to just sit and concentrate on, your text. So, yeah, if you've got a lot of things going on, a lot of stress in your life, you oftentimes have the inability to concentrate. Lack of interest in activities. Yeah, I know y'all are going to the pool today. I just don't feel like it. We're going to the lake. We're going to be, you know, skiing, whatever. Yeah, I just don't feel like it. You don't feel like it? You always want to go, yeah, I just don't today. Changes in sleep patterns, or they start having nightmares, or they just can't sleep, or they're wakeful, they sleep and wake. Changes in appetite. Usually you see both sides of that. When I'm under stress, I get the let's eat more side. Some people get that, I don't feel like eating side. I never get that one. Guilt. Why would a healthcare provider feel guilty? Yeah, they died. And what? Because sometimes you may feel like I could have prevented this, or if I'd done something different. I mean, there have been plenty of times I know for all of you where you felt like, if I had just done blank, you'd have had a different outcome. Yeah, but most of the time that's the case. If I'd done something different, we'd have had a different outcome. And usually, in most cases, there's nothing you really could have done different. You know, you're trained, you know what you're doing, you're educated, you do the best you can, and there's still a bad outcome. It's not your fault, but sometimes you feel it. You start scrutinizing, God, did I do that? Should I have given them more oxygen? You know, should I have held pressure longer? You know, should I have done this? Should I have done that? You know, none of us are perfect. We're all going to make mistakes, and we all make mistakes. I do too. But sometimes we feel guilty about something. And if you feel like you didn't manage something right, or you didn't do all that you could, or you did the wrong thing, how are you going to feel like the next time that kind of call comes up? Are you ready to jump in there and right the wrong? Most of the time you're scared to death. I screwed this up before. I'm afraid I'm going to screw this up again. So sometimes you get that failure to engage. Y'all saw Top Gun, right? Remember Top Gun? Remember Tom Cruise? Yeah, some of you going. I know that's before you were born. It's okay. Other people sing it. I saw it when it was black and white. Anyway, remember he was flying around being a hot dog and he ends up getting his buddy killed? So after that, he just was afraid to engage. He was afraid he was going to screw it up, you know, hurt somebody. But we see that in our field too. You're so afraid after that last mistake you made that you're going to screw it up again. So you're kind of hesitant to engage. And so that's going to be another sign that you'll see. You know, you may be working with a partner who's always been on top of their game and they're used to taking charge and doing everything right. And now after a patient had a bad outcome, they're afraid to get in there. They're afraid to commit. They're afraid to make a decision. So you do see that quite commonly. And sometimes they want to isolate themselves. They just don't want people around. You know, we're going to the lake. No, I'm just going to stay home. So they kind of back away from people. So those are signs and symptoms of a person that's having a hard time coping with a lot of stress. Okay, if your partner's beginning to show signs of stress, what should you do? What should you do first? You notice your partner's coming in late to work. He's got puppy eyes. You know, his color's bad. You know, he doesn't really care about what he does. He doesn't care about cleaning the truck. He's always the first one in there. You know, what should be your first reaction, first response? Who has an idea? Talk to him. What would you say?
Ask them if they're all right.
Yeah. What's going on with you? I don't feel like you're yourself lately. Is there something, you know, we can talk about or anything I can do? Sometimes they'll open up to you, sometimes not. Okay, if that doesn't work, and you notice that he's, you know, getting later to work and he's starting to be disinterested in patient care, you know, he goes to do an assessment on a patient and he just asks him a few questions and he's done. He goes, well, you don't really know, you need to go to the hospital, you know, and off they go. Now, where are we getting? Yeah, if you really talk to the person and they are not picking up what you're laying down, you know, they're not listening, they're not accepting what it is you're trying to talk to them about, then you may have to take that to the next level because your main concern is what? Patient care. Yeah, if they're interfering with patient care where they could injure a patient, then it's important that you do something. You hate to do that, but if you're doing it for the right reasons, you're not just reporting somebody because you're sick and tired of working with them. But if you try to talk to them and they're just not forthcoming, they won't, you know, buy into it, then you may have to take that to the next level. What possible risk could there be to your partner, you, or your patient if stress is left unresolved?
Not proper care of the patient.
Yep, bad patient care. But you also might lose a really good care provider. You know, it may be a person that's been a great care provider and they have this problem. And until they can get it resolved, you know, they're not going to get back out there and be good. But you hate to lose somebody that's you know, invested a lot of time in this, you know, especially if they're good. So, yeah, it can be bad for everybody. Do you have an obligation to act to help your partner? Yeah, you do. Ways of dealing with stress. We talked about these. You need to eat right. And I can tell you that EMS providers have the worst diets on earth. You know, because we never know when we're going to eat. You know, sleep, you just don't know. I mean, we've always had a theory, or a theorem. You eat when you can, you sleep when you can, and you go to the bathroom when you can. Whether you have to pee or not, you go because it may be 6 hours before you go anywhere close to a toilet. And I did have a patient one time, a partner one time that he had to go so bad, and we've been running for so long that we go into this patient, and he goes, if you'll talk to the patient, I'm going to ask him if I can go to the bathroom. I said, can I use your bathroom, lady? Sure, but that's kind of embarrassing to do. But yeah, you need to eat right, sleep right, and plan well. You need to make sure you allow time for a wind down for you. You can't work 80 hours a week. You just can't do it. It's too high stress a job. So if you're working as an EMT in the field, work your regular shift, what you're supposed to do. And if you feel like you need to work, go and cut grass or flip hamburgers or do something different. But don't keep doing this job day in and day out. It'll kill you. I don't want to read about you in the paper. Oh, Haley, she worked herself to death. She worked EMS every single day till it killed her. Now, there's something called critical incident stress management or stress debriefing. And it's in your textbook. You may see it on National Registry, but they really don't do it much anymore. It's kind of an old theory. They thought that after a critically difficult event, they'd gather all the parties together. We would just kind of talk it out, and they'd bring in some healthcare professional in there and tell you everything's okay. And honestly, as EMS providers, we just don't respond well to that. We'll talk to somebody that was there, kind of one-on-one, but we don't share that in some big old group and say, oh, it was terrible. I can't believe that happened. We're generally not criers, and that's kind of what they're looking for. But it is a very regimented system where they bring in healthcare professionals that or professionals from outside of your people that you don't know, and they bring you together and you have little meetings together and stuff like that. They call it critical incident stress debriefing. And like I said, they don't do it much anymore, so you're probably not going to have it. We usually do a much better job of managing it as a group of professionals than if we bring people in. Okay, let's talk quickly about death and dying. Even though most of our patients don't die, some of them do. And we have to manage that. Some it's where we're trying to prevent death, we're doing CPR or we're giving an EpiPen or oxygen or whatever it is trying to prevent death. But sometimes we may have a terminal patient that we'll respond to, and we know they're dying, they know they're dying. We just kind of stand by and go through this process with them. So we really see patients in all stages of this, and that can be disturbing for you, particularly if, say, it's a traumatic injury or an unexpected death. But if it's an expected death, sometimes that can be a quite interesting and not pleasurable, but a rewarding time to spend with a patient. I know quite a few times where I've sat and just held the hand of a patient, and they knew they were fixing to die. Or we're talking about within minutes, and sometimes you may pray with a patient or try to soothe them or comfort them, and that's a nice part of our job sometimes, but it can be very challenging. Here in the United States, particularly, but also other areas of the world, we experience death much different than we did, say, 100 years ago. And I can speak from experience. I feel like I'm 100 years old sometime, but I think I told you my father's family was from Slapout. Remember? Is that what you're talking about, Slapout? The day class? My dad's family was from Slapout. In the olden days, my grandmother died when I was quite young. They brought the body into the house. It was the homestead where all the family was raised. They bring the body in, and it sits in state there, and they have a wake and everything. I had to sleep over in that house. It was kind of scary. So in the olden days, that's what they did, and people were used to that as a dying process. Most people died at home, and family was around, and they just kind of helped them ease into the next world. Not so much now. Most people die in the hospital. They're away from their family. They're being cared by a bunch of people that don't know them. So it's a very sterile environment. So a lot of the families that you'll respond to in the event of a death in a home, that was not what was expected, and they've never dealt with death on that level. Now, after a while, you'll be used to it because you'll deal with it, but they oftentimes are not, and it can be difficult for the family, but it may be also difficult for you because you haven't experienced death like that. Does that creep you guys out? Does it creep you out just a little bit? It's okay. You can say it creeps me out. It creeps me out, but it creeps you out. But yeah, it's something that you'll get used to. But if you look at it, that you really are kind of standing in the gap for this family or with that person, in that you can help them transition or help comfort them at a very difficult time. That's very rewarding for us. Sometimes dealing with the family can be very difficult. They don't always say, "Oh yeah, Grandma's passed away." What kind of response do you think you get lots of times?
Hysterical.
Yeah, you killed Mama. If you'd have been here 20 minutes ago when I called, Mama wouldn't have died. But you know, there's stages, you know, of this death and dying that people go through. And I think we'll talk about that here in a minute. And part of it is getting to the point where you accept it, you know, yeah, I'm going to die. But lots of times they're caught in that denial thing, or they want to blame somebody, or they want to rationalize that. So you're convenient. So it's not uncommon for them to take it out on you. Yeah, stages. Stage 1 is going to be denial. Not me. I can't have colon cancer. You know, I don't have this. This didn't happen to me. Can't happen to me. The next, they're usually angry. Why is this happening to me? Everything happens to me, you know. Why me? Very few people escape this life without terrible things happening to them. So then they go through that anger stage. And then there's bargaining. Okay, I know that I'm going to die, but first let me, you know, see my daughter graduate from high school. My neighbor across the street passed away a week before his daughter graduated back in May. And I know that was very difficult for the family. So they start bargaining, you know, with God. God, if you'll just let me do this, I promise I'll never do blank again. Really? Then they move into a depression. You know, man, I can't get a break. You know, I haven't been able to do all the things I want to do in this life. You know, I wish I had done this. I wish I'd done that. And then the last stage is that acceptance. And that's a really beautiful stage that if you can sit through that with a patient, that they know that they're going to die, they've made their peace, you know, they've talked to all their relatives, they've, you know, given their stuff away, whatever it is that they do, and they're okay with it. You know, I wasn't meant to live a million years. You know, I knew this was going to happen. I'm okay with it. So these are the stages, and everybody kind of goes through these. Some they zip through just in a matter of seconds almost. Others they may get caught in for a long time, like depression or anger. And they may not take them in that order. But pretty much the patient goes through these as well as the family members. The loved ones go through these stages. You have to be able to recognize them. Because if you walk in and, you know, the fire department's doing CPR on grandma and the family member is freaking out, do something, do something, do something. You know, where are they? They're in denial, you know, or they're mad. So, you know, you got to recognize that's not aimed at you. They're just emotionally disturbed by whatever the situation is. When you're dealing with patients that are involving a death, either, you know, family member or somebody close, you need to think about treating them like you would want to be treated. You know, just because they're angry and they're yelling at you, that's not a license for you to yell back at them, because they're not targeting that towards you. If that were you in that situation and you just lost somebody close to you, then you would hope somebody would come along beside you and be kind and understanding. Now, try to recognize the patient's needs. You know, if they know they're terminally ill and they have some issues, recognize what it is that you can do for them. If it's palliative, meaning providing comfort, or if they need you to do something. Y'all met Tim the other night. He had a patient years ago. He may tell you about him, but we were in Pensacola, and it was a young man, probably in his early 30s, and I don't remember what happened. I don't know if Tim remembers, but the guy was very ill. I think he'd been injured maybe, and he was fixing to die. And Tim could see that in him, and I think the young man knew that he was going to die. And he asked Tim, says, can I use your phone and call my wife? And that's something that we don't do. Patients don't talk on the phone in the back of the ambulance any more than I'd let you guys sit here and talk on the phone during class. You just don't do that. And the thought of giving your personal cell phone to a patient, you just really didn't do that. We was talking about quite a few years ago. But he recognized what was going on here, and he gave the guy his phone. He said, absolutely, make your call. And he called, and the guy talked to his wife for about 10 minutes, and, you know, this is what's happened, come to the hospital, I love you, you know, whatever it was. And the guy was dead within 30 minutes. You know, his wife never saw him again. So being able to provide that care for that patient, even though it wasn't in our protocols, it wasn't something where if a patient asked to make a phone call on your phone, you know, you have to let them do it. You know, that's not written down. But as part of you having compassion for your patient, you might do that. So consider what their needs are and try, if you can possibly do that, interact with them that way. Be tolerant of patients or family members that are angry at you, because it's not you, usually. Listen empathetically. What does that mean? You know the difference between sympathy and empathy? Come on, y'all know this thing about it. Empathetically, sort of like that. If you have sympathy, I feel bad for you because your arm's broken, but I don't really know what that feels like. But I know it's probably not good. So I sympathize with you. If you have empathy for somebody, it's like you put on their clothes and you feel it for them. So you empathize with somebody. You know, I've broken my ankle. If you've broken your ankle, I can empathize with that because I've been there. Sometimes we can empathize with a patient even though we haven't actually been there, but we're able to kind of put on their skin and feel their pain for them. So try to listen empathetically so that they really feel that you really do care. It's not just like, man, you broke your arm, I'm glad it was you and not me. That's sympathy. I'm sorry, but anyway, empathetically is where you actually try to feel it for them. Don't falsely reassure them. Hey, buddy, you're not going to die. And Tim would never in a million years have told that patient, you're going to be okay. Because he knew that patient wasn't going to be okay. So you don't lie to your patient. But don't say, yeah, you're fixing to die. Say, you know, we're doing everything we can for you. Doing everything we can. So try to be as honest as you possibly can, and then be comforting. Scene safety, y'all ready for this? Y'all think we're never going to be done. Okay. Generally speaking, EMS is not dangerous in that like we're going to be blown up by a bomb or something. There are other people, firefighters, police officers, that kind of wander into those more dangerous situations. So EMS is not inherently dangerous, but because we kind of ride on the tailcoats of these other people that do dangerous professions, we're kind of sucked in. You know, if it's a bad wreck on the interstate, you know, we're not driving big fast cars or big fire trucks or anything, but on the side of the road, you can be killed. I had a former student, and I'm sure some of you guys read about this, probably 3 years ago now, a former student of mine down at USA, one of my paramedic students, she got killed on I-85 outside of Montgomery, running a MBA on the side of the road. She had a 3-year-old. It's terrible. So scene safety is something that sometimes we get tunnel vision about. You know, if you pull up on a scene and it's like a really interesting scene, everybody looks at that a little bit differently. Some of it's really gory. Some of us kind of go, yeah, this is a good call. Others of us are going, ooh, not this. So yeah, but you pull up on a scene and you know you're going to be really busy. There's a lot of things going on. You got to get your backboard, and you got to get your BSI. You got to make sure that you park off the road so the ambulance doesn't get hit. You care about your patient, God, they're bleeding all over. I got to get some wound control here. So you're thinking of all these things, and your eyes kind of go like this. This is my patient. And suddenly, we don't see the traffic going by out here. You know, we don't see the rubberneckers going, oh my gosh, look at that, as they drive off the road and run over you. So sometimes we kind of get tunnel vision. We're focused on our patient, and we forget that we may have an unstable environment around us. So the purpose of this lecture here is to remind you not to get tunnel vision. But we all get it. But you have to really work to avoid it. You have to remember that you have to be careful for your own personal safety, because nobody else is really going to look out for it for you. Be aware of potential dangers. It's always going to be a priority for you. Because if you're not safe, you can't care for other people. So determining that the scene is safe will be the most important decision on any call. 99% of the time it's safe. All it takes is that 1%. I think I have a video in here I'm going to show you in a minute. This is a potentially hazardous scene. What's she doing?
Looking at the placard.
Yeah, she's got binoculars, and all ambulances should have binoculars on there. Do they always? Not really. If you don't have it, I'm asking for some. I want my binoculars. I can't see that far away to read a placard. I can see that it's probably got some red on it. But yeah, you're going to stay away. Nay, nay, stay away. Somebody recognize that one? Nay, nay, stay away until you're sure that it's safe. Some type of rescue operations, that's going to be where the fire trucks are there. They've got the jaws of life and all that kind of stuff that they're working on the scene. Those are rescue operations. They're bringing somebody up out of a deep hole or something. Those are rescue operations. And they're inherently dangerous. Anytime there's any violence on scene, most of the time your dispatcher is going to dispatch law enforcement with you if they suspect any violence. But sometimes those people don't let you know. Was it up in Boston somewhere, a few months ago, where the fire department, the paramedics responded, and the guy shot 4 of them or something? Do you remember that? Yeah, so there wasn't anything to indicate possibly that there was a scene. The guy called 911, oh, I'm sick, or I'm hurt, or whatever, and that's what we do. We respond, we're here to help. You know, so you have to just always keep that in the back of your mind that there could be a problem, so that you're always alert and you're always looking. I know for me personally, if I walk into a patient's home, I'm always carrying a jump box or an airway bag or something, and I always make sure I set that between me and the patient. In the event I have to turn and run, they're going to have to step over it or trip over it. Or if you run, you may have to just turn and throw it at them, but I'm always going to have some kind of weapon. Like, I always try not to put my back to the door. You notice I don't have my back to the door here. Some instructors will do that. I want to know what's happening in my hallway. I like to keep the door open. So always keep your eyes open so that you know what's happening around you. You know, listen for animals. Listen for other people in the house. Here, say, for instance, on the university campus, I mean, you could respond in just about any place where there's a lot of people and a lot of drinking and, gosh, maybe even some drugs. Who knows? Those are very unstable situations, but you could have somebody that's sick or injured in one of those settings, right? So you always have to be really careful, especially anytime there's a weapon. Sometimes you may have to stage, which means that there's been a report of shots fired. You're not going to like just drive up there and grab your bag and go running in because, ooh, I know I've got a gunshot wound here. No, what you'll end up doing is parking some block or 2 away from the scene until law enforcement can get there. They will disarm or settle or whatever they need to do. They will make the scene safe so that you can come in and treat somebody. And that's entirely legal. There's been plenty of legal cases that have supported that. There's one in particular in Los Angeles quite a few years ago where there was a shooting. There was a young man that had been shot. He's laying out in the front yard there somewhere. And the medics came, but they didn't go up to the scene. They parked away until law enforcement got there, settled the scene, and that was probably a good 30 minutes until they secured the shooter and made sure everything was under wraps, and they cleared the medics to come in. Well, the family sued because they showed that if that guy had had immediate care, he likely would have survived. Well, they didn't win that case because we're not required, and we shouldn't go into an unstable scene. If it's not safe enough for us to, if we get shot, now we got a bunch of patients. So legally, we've got every authority not to rush in there, and I would suggest that you not do that. Wait until law enforcement clears you to enter that scene. Okay, there's some stuff in your book here. I'm not sure where all this stuff comes from, but you need to be prepared with a plan in your mind if there's an incident. You need to play it through in your mind. What am I going to do if I'm taking a blood pressure on a patient and all of a sudden somebody steps out of the back room with a gun pointed at me? Besides wet my pants, I'm not really sure what I'm going to do here. But you need to think about it, what you would do. Because what happens here is your brain doesn't know the difference between what you told it to do and what it's actually done. It's kind of like you're creating a pattern for it. So if you review that in your mind, this is what I'll do. It's just like I always take in something with me so I can put it in front of the patient. I just always do that. I always make sure that I have a clear shot to the door. That's just what I do. So if you always have a plan in place, whether you actually had to carry it out or not, it doesn't really matter. But think it through. What would I do if? And if you kind of play those little games, really in all sorts of, all through your walk of life, but if you will play through how you would manage certain situations, when they come up, you'll manage them just like you practice it in your mind. Always carry your radio with you. Now, I understand that there are some units, some services, none I hope, but I've heard there are a few, that both partners may not be issued a radio. Both of you need a radio. And I'm not going out on that truck without both of us having a radio. Because if you get split up, which happens very commonly, you may need to communicate with one another. So both of you having a radio is very important so that you can get help if you need it, contact your partner if you need it. Decide going in, who's going to be the guy that stands back and is the observer, and who's going to go in and treat the patient. So usually if there are 2 of you, one of you's in here focusing on the patient, the other one's focusing on everything else. It's almost like they're watching your back for you. So So if you work with the same partner, you'll kind of develop those roles. But always keep that in the back of your mind. What would I do if? So that you have a plan for that. Make sure you are using your eyes and using your brain so that you think about the different things that can happen. If you think that there is a volatile setting or a volatile scene, don't come rushing in with your lights and sirens. You might make yourself a target. So back up, turn those things off. Drive a few feet past the residence. If you suspect a problem, go ahead and drive past it and circle around and take another look. You know, usually you have an inkling that there's a problem. Sometimes dispatch may tell you, we've responded to this location 3 times this week, and you know, each time there's been nobody home, and you knock on the door and nobody ever answers. And you say, oh, well, there's something going on there. So I might drive by, you know, and take a look. So just think about what can be going on. So be observant. Certain types of situations should cause the hairs on the back of your neck to raise. Any type of history of violence, or if the call comes out that it's some type of traumatic injury and that, you know, somebody's been stabbed, somebody's been shot, those are things that I always want to make sure I've got law enforcement, and you always have your little tentacles up. Any alcohol or drug abuse, there's always a potential for danger there. Weapons, family members can get awful freaked out sometimes, so don't ever think, you know, family member loves your patient, maybe not so much. So watch out for family members, bystanders, pets. Now, y'all think that's funny, don't you? Pets, watch out for pets. What's the deal with pets? I told you last night. Yeah, it can even be a little bitty dog that will attack you. Yeah, oftentimes dogs are very protective of their owners. And now owner's sick, dogs know owner's sick. And they're very protective. And even though you're going in to help, they may not understand that action. And there's some funny stories out there. If you Google them, there's some really funny ones. One in particular, I know I had a friend work for the service I was working at. And they went in, the woman was on the couch, you know, kind of laid back. I think it was low blood sugar or something. And he got right down there close to her, squatted down, kind of kneeled down, because he was going to start IV on her. And out from under the daggone couch comes this little bitty dog, and been in a very bad place. So dogs, yeah, I always want to know, are there any pets that need to be secured here? Because things freak them out. And I told you I've been bit several times, and it scares me to death. Okay, the 3 R's, retreat, radio, and reevaluate. If you don't have a radio, you can't radio anybody. So make yourself safe. Get back, call for help. If you acted too soon, you know, it really wasn't a threat, you know, they're going, it's okay, it's okay. You can reevaluate that, but make yourself scarce first, and then radio for help. We did actually get to this chapter. Now, there's a chapter review, and there are different questions on the end of each chapter, so make sure you read through those. I'm going to go through them fairly quickly. But understand how important your BSI is, you know, that you keep yourself safe. Make sure that you keep your little tentacles up here so that you, or your antenna, if you like, so that you can determine if there's an unsafe scene for you or any danger. Protect yourself from disease. Watch out for stress. Treat people fairly. Remember, this is very important. Remember that scenes are dynamic. What does that mean? Does it mean it's going to explode like dynamite? Changing. Dynamic means it's changing. And that's a term we're going to use a lot this semester. Our patients are dynamic. Scenes are dynamic. Just because it's safe when you first get there doesn't mean it's going to be safe in 10 minutes. Just because the patient was safe when you put them in the back of the ambulance, that doesn't mean they're still going to be safe by the time you're getting out at the hospital. So scenes are dynamic. They can change very rapidly. So always be alert for that change. Doing a scene safety evaluation is ongoing. You always want to protect your own scene safety. So you're always evaluating. So if you got a test question that says, when do you evaluate scene safety? Even though I'm going to give you some sheets and we're going to learn those sheets, and it's going to say the top of your list is going to be scene safety, you know, scene size up, is everything okay here? You're not going to say that you're done then. You're never done with scene safety until you drop your patient off. Then you can quit worrying about the safety of the scene. Don't be so focused on the patient that you lose perception of what's happening around you. Things you're going to think about. What precautions must I take if I'm dealing with a patient who has an open wound? What type of BSI am I going to use if I have a patient that's bleeding all over the place? Gloves for sure. If it's spurting, yeah. If it's spurting, I'm going to have eye protection, and I might even cover up my mouth too. I don't like blood in my mouth either. What can I do to help deal with stress? Yeah, keep a balance in your life so that you can diffuse that stress, so you can handle it before it handles you. You will. Okay, critical thinking. So I told you we're moving so that we learn to be critical thinkers, right? You're called to an unknown emergency at a tavern. Is there anything in that first sentence that like kind of sets little tinglings in your body? Tavern. What do we know happens at taverns?
Drinking.
Yeah, drinking. It may be drugs. So you may have people with altered mental status. As you approach the scene, you see a man lying supine. What's supine? On his back. Prone is he's laying on his stomach. Supine, he's laying on his back. So you can picture him. He's laying on his back in the parking lot, and you can see that he's bleeding profusely. Profusely means what? Lots and lots, yeah. So that to me, I can probably see him squirting there. There are two other men, and they're scuffling, and one seems to have a gun. What does seems to have? I guess I need to change that. One has a gun. Apparently has a gun. How's that? So he has a gun. What must you do? Yeah. Retreat, radio, and what's the last one? Reevaluate. Yeah, I'm getting the heck out of Dodge there. I'm sorry for the guy that's bleeding. I hate it that you picked your friends very badly. Made a poor choice there, but I'm leaving. It looks like a storm brewing. Okay, what time is it? Y'all take a short break, and we've got to get this show on the road. So stop.